Good morning. I am Dr. Kular. Today we will discuss which surgery we should choose for our weight loss. We get confused when we look into the internet. There is a lot of data. Different types of procedures are available, like gastric band, gastric sleeve, Roux-en-Y gastric bypass, mini gastric bypass. Then we have duodenal switch, BPD. There are 100 different kinds of surgeries which are available on the internet. One gets confused. Which one is better for me? Basically, we should understand if we group these procedures broadly, they are only of two types. One is purely restrictive, and the other one is a combination procedure, which would be combining restriction and malabsorption. Restrictive procedure means like band, where we put a band inside so it makes it tight. So once you eat a little bit, it will stop here. You will feel full. Similarly, sleeve. In sleeve, we decrease the size of the stomach, cut the stomach, staple it to about 1/10 in size. So ultimately, it will give you restriction. You cannot eat too much. Roux-en-Y gastric bypass. Again, it's primarily restrictive. It has got a very small pouch, very small outlet, so you can eat a little bit. And in addition to that, it has got some component of gastric bypass, but it is primarily restrictive. Then comes the mini gastric bypass, where you have a relatively bigger pouch. You have some luxury to eat, and some luxury to come back to normal eating quickly, because the outlet of the pouch in mini gastric bypass is bigger than the sleeve or the Roux-en-Y gastric bypass or the band. So if you want to eat more and eat quickly after surgery, say on day 1 or day 2, if you want to eat, then we have the mini gastric bypass surgery for you. And for those where nothing is working, we have the duodenal switch and BPD, but these procedures are more complicated, and they need very close monitoring in terms of the deficiencies and the other things in the long run. Basically, you have to ask this question to yourself: what exactly do you want? Like if you go for shopping, if you know this is the kind of stuff I'm looking for, I want a gray colored suit and it should be like this, so you will do the shopping in 5 minutes and come back with the right thing. And if you do not know what exactly you want, then you might be doing shopping for throughout the day, and then in the evening you come back with the wrong things. So what do you want? Number 1 is safety. Number 2 is efficacy. If we do a procedure, it should work. You must lose weight. Number 3, it should be durable. The weight loss should not come back very fast. Then it should be reversible. This is something big which I consider after my practice of about 8 years into bariatric surgery. Why reversible? Because these procedures take your weight away. 1% out of 1 is sometimes taken out, like somebody's 200 kilos goes down to 100 kilo or even lower than that. So what if your weight goes down too much? If you lose too much of excess weight, or you have some kind of deficiency or any problem, I think if a procedure is reversible, it's additional benefit for the patient that it can be, you can get out of it. There should be some easy exit strategy. And a procedure, whether or not you want it to be tolerable according to your choice, For that, you need to look into your eating habit. What kind of eater you are. If you're a low volume eater or a high volume eater. Low volume eater would mean if you eat just a moderate amount of diet, like if you look into our Indian patients, chapati, if you are taking 2 chapatis in one go, or 3 chapatis or 4 chapatis maybe, you are a moderate volume eater. But if you are eating 10, 12, 15 chapatis in one go, then you are a high volume eater. Similarly, you can say 1 burger or 2 hamburgers, maybe moderate volume eater. Or if you take 5, 6 burgers in one go, then you are a high volume eater. So if you are a high volume eater, if we restrict you from eating, maybe you will lose good amount of weight. So a restrictive surgery should work very well in high volume eaters. But if you are a low volume eater, say if you are taking only 2 chapatis or only 1 burger in one go, and we want to make your stomach tight, how much I should make it tight so that you lose 50 kilos, 100 pounds or maybe more? It has to be made very tight and you might not like it. So what I have seen in my practice is that the low volume eaters, they benefit more from the combination procedures like the mini gastric bypass or the Roux-en-Y gastric bypass. But the purely restrictive procedures do good in high volume eaters. Okay, so this is one thing. What kind of pouch you want? Because if you go to a tailor, you tell, this is the kind of trouser I like. It should be this big, it should be this long, and this is the kind of fitness I want. But once you are getting your body tailored, and there's every reason why you should not have this option of getting to know that what kind of different tailoring procedures are available. So a low volume eater would need something that he or she is still eating a moderate amount of diet after surgery and still losing weight. So how is that possible? That means we have to decrease the length of the intestine. And if we look into this matter, on an average, we have 27 feet of small intestine available for absorption. God has given us this design, and this design is probably very old. We have got a large, huge stomach and long intestine, 27 feet in length. If we make the stomach smaller, you lose weight. And if we make the intestine smaller, you lose weight. So in bypass, there is a combination. For a low volume eater, we would need a moderate size of pouch and a moderate length of bypass. For a high volume eater, we might need a very tight pouch and a long bypass.